Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And welcome back. This is, of course, our COVID update and our first segment, all courtesy Fulltech Systems. It is now that time in the morning whereby we venture off into a conversation, and for today it's actually a conversation with Dr. Manzanero, who is the Director of Health Services for the Ministry of Health. Dr. Manzanero is in with us. Well, he's on the screen. Dr. Manzanero, good morning, sir.
Hi, good morning.
And we know that you got some rest in, but probably not as much as you'd like. First,
and I think it worse, I think.
First and foremost, sir, what we'd like is an update. Everybody saw yesterday, or last night, actually, on social media, breaking news there of some 15 cases. Can you give us an update at this particular point as to where we are with COVID?
Yeah, well, actually, we had initially, I know the invitation had been for me to have been yesterday on the show. We couldn't do that because of the activities that happened on the weekend when we identified 8 cases first on the Saturday and then 1 on Sunday. So we didn't do the activity yesterday and not knowing what was, of course, brewing. So I am here just because we had already postponed this once. Okay. So yesterday we found 15 new cases we identified, confirmed, because some of those have clinical suspicion. So I think that's the word that we should use. We confirmed 15 new cases. That's a record number. Actually, in one day, you almost find all the cases that you had in your first, if you recall, the first 18 cases that we had. And we also had a record number of samples being processed. 148 samples were processed yesterday. Some samples were being extracted last night. Those will be run this morning. I don't have the final figure of what will be processed today, but it is a significant amount as well.
Yeah. So that's one of the points that I wanted to clarify, because I think you made note of the fact that not all the samples, and especially those that came in yesterday evening from San Pedro, have in fact been processed and tested as yet.
Yeah, not all of the samples from San Pedro. We will still have some samples pending from Corozal. I believe that the only samples that came out of the contact tracing that started on the weekend, as soon as you identify a sample, those were processed from the Orange Walk, and I think those pretty much went all of them through. So, but I don't think all of the ones from Corozal, and certainly not the ones from San Pedro, those are not there yet.
So the 15 new cases, how many of them are tied to direct contact with the already confirmed patients?
Okay, we because this is a preliminary breakdown. Once we get the results, and the reason why they come out so late is, one is the amount of samples you're processing. Once you have any sample in that, you have to go through a confirmation process, so that delays the entire release of results for the entire batch. And especially when you have 15, and then what you do is we have a line listing, which you look for all the cases, where they're from, what's the link. So sometimes we are not able to provide information in real time. So what we know, and that information is what I know right now, then, because as you start to tidy up your information, you're able to make more connections. And so what I do know is, out of the 15 samples, 5 of those are from a repatriation process, which means these 5 persons would have been coming in through the legal border. All of them came to the northern border station. That's why they are either identified in Orange Walk and Corozal. So out of the 15 samples we had labeled last night, 7 as being from Corozal, 7 from Orange Walk, and 1 from San Pedro. That's what the press release had said. 7 from Corozal, 5 are considered to be from the repatriation process, which means they came in and subbed in Corozal. It doesn't mean that they are now in Corozal. They could be in Orange Walk, or wherever they are moved for quarantine purposes, but that's why they appear on the Corozal data. And 2 of the other ones from Corozal are linked to the case we identified on Saturday. So that makes up their 7. So
Okay.
those we managed to establish clear links. I do have to say though that we are now starting to document, it seems, and it is expected people going for treatment in Merida are going to be at a higher risk. So at least 3 of those 5 cases would have been people seeking medical attention
From the
in the
repatriation process.
yeah, because
Okay.
repatriation does have to mean you're coming from the US or
Yeah.
it's people medical treatment, you are labeled them
Yeah.
as such. We have to be people seeking medical treatment, I'll say we have to be taking extra precautions in that light.
Yeah.
So that's the 7 from Corozal.
When you say that 5 cases seem to be unrelated, and I appreciate what you're saying as of this point, because further investigation may reveal that they're a contact of a contact, or maybe didn't know that they had come in contact with a positive case. So further investigation may change that status. But
Which is by the end of the day, once you start connecting your dots, if you will, if we can connect them, because there might not be anything to connect. So that's why I'm saying the 7 of Corozal, we have managed to kind of place those in and see where they are.
Now, when you look at some of the cases that have been identified, it is concerning because of some of the details that have emerged so far. And I know that the ministry is very keen, and you keep on speaking about not revealing names and identities for the matter of avoiding stigma and discrimination. But because of our small community, people have an idea of persons who are positive. And so what we do know is that a police officer has been infected. We know that one of the persons was very social during a time when she was sick, the patient in San Pedro. And the recent batch also includes the positive case of a nurse. These are all factors that definitely are concerning to the wider public. I want to get your feedback on that, just the level of engagement that these type of people have had.
Yeah, well, in the nurse situation, she doesn't seem to have gotten infected within a health facility.
Okay.
And that's why yesterday at the press conference, I had highlighted with other cadre of public officers who are considered frontline that if you take your necessary precautions within your work environment, within a hospital setting, in the case of healthcare workers, that might be all fine and good in terms of protecting yourself and protecting patients that you interact with. But if you are out in the public and you are not taking the same necessary precautions, I'm not saying taking a full PPE outside, but then your exposure is going to be there. And we have always, well, I think for the last 2.5 months, we have been saying you have to assume that everybody you meet, you have to consider them as a potential case.
Yeah.
If you want to add further to that message, if you want to dissect it even further now, because people are now suddenly starting to be more concerned, when I don't think that the level of concern should have been dropped at all from 7 months ago. We will have to go back internally. Every single person in this country has to go back internally and find out who you have interacted with for the previous 14 days, what level of contact you had, and what level of physical distancing, wearing a mask you kept.
Yeah.
And I'm saying this because once we start, as Marlene has just asked in terms of the police officer and the nurse, once you start looking out of the 15 people that came up yesterday, and some of them we don't have a link right now, you have to start to map out those social networks, and you will understand how extensive it is going to be, how extensive it already is, because we are now, people are concerned about Orange Walk or Rosal, but it's everywhere. We got calls late last night of people saying, oh, I was with this person, I am now in Benque, I'm now in Placencia. People starting to show up symptoms across the country.
Yeah.
So
for clarity though, can you let me know, just in terms of resources, how many contact tracers do you have on the ground at the moment?
Well, the contact tracing teams are, contact tracing is, we put all the public health inspectors, all the nurses that are required. What will happen today, for example, is you go to the table and you might have to do what's called task shifting. You might have to require more nurses. We don't have that many resources. I can't give you a figure of how many people are out there, but that can also start to be overwhelming. Eventually, you might just have to say, okay, if you, like we did in April, if you were at this event with this person and you're having symptoms, you have to come in.
Yeah.
One of the notes we did say yesterday, and I was the one who placed that specific two words in the press release, is stay calm. Why? Well, I don't know what other advice I can give you at this point in time, because we have to start to digest where we have been the previous 14 days and what level of contact we have had. And then we wait for the mapping exercise and the contact tracing. But so if people know, because Marlene said people we know each other in the community, so to speak.
Yeah.
If you lose contact of the person who was positive and is symptomatic, you really have to stay put.
Yeah.
You have to stay. That's what I mean. You have to stay calm, stay put, and then seek the adequate medical care depending on the symptoms you have.
Dr. Manza, when it comes to the testing process, so there's a contact tracing for those from those who we have learned or who have tested positive before. Now, when we go or when the contact tracers go into those communities to test somebody, are these people automatically put into quarantine, or these people must wait before a test before they get a negative or a positive answer? And following getting the positive answer, do we call them automatically and tell them you're positive, you need to get into quarantine? What happens there?
Well, that's the reason why we also take long to give the results, because the people must be aware first. We need to inform you first that you are positive before we are able to publish any information. So once the results come out, you also have to call these persons. Sometimes it's difficult to get to somebody, but that's what routinely happens. If you're a close contact of a positive case, you're going to be swabbed and you're going to be asked to stay. Don't go to work if you're in a public front line, and what necessary precautions until you get your result. If the result is negative, if your risk has been significant, we may have to come back and retest you. So for the next 10 to 14 days, you may still be asked to basically remain in self-quarantine. That is determined by the team on the ground. So people, people go into self-quarantine and then come back to us and say, oh, I was in quarantine for 14 days for X, Y, and Z. But that determination needs to be made in tandem with the health team. Of course, if it starts to be more than overwhelming at the end of today, once you have gone through all your processes, you understand that we will not have the ability and capacity for contact tracers to go after all this extensive network, because it is just it's already starting to look very, very extensive.
Well, that's kind of why I wanted to get an idea of the resources. I mean, are you talking about like 5 people in San Pedro working to do contact tracing? I mean, because if there's a need for more resources, it is important that we know that you can cover more ground if you have more hands on deck.
So that's determined by the end of the day. I mean, if by the end of the day we realize that this network is so extensive, then you will have to use other mechanisms to try to get to persons. If you realize you can't go out and meet physically and you're not getting forward with phone calls or interviews via the phone, then you have to use other platforms to try to get to persons.
So if we look at some of the 3 concerning cases, there is some knowledge in terms of their behavior. And again, I say because it is a small community, so word gets around. Of course, we know the Orange Walk case that went to a school meeting. We know that it's a police officer in Corozal, and I don't know the scope of her duties, whether she was moving around or interacting with the public, but clearly she wouldn't be stationed in one place. And then you also have the San Pedro case, where we do know that there was a lot of interaction with different persons. So how do you, when you do your contact tracing, and these 3 cases specifically are symptomatic, they do have, I think you said respiratory symptoms. When you do your contact tracing, because you're saying to the public, if you know who it is, think if you've come in contact with that person. Are you going back from the day of testing positive, or the day they first started to show symptoms?
The day they first started with symptoms, for those who are symptomatic, you go 14 days.
So based on what you know so far from the symptomatic cases, the 3 that are being investigated in Orange Walk, Corozal, and San Pedro, how far back do you have to investigate for these individual cases?
Well, everybody was different because, for example, the patient in Corozal has been in the hospital now for over a week. So you have to basically go back to almost the second week of July in her case in trying to identify the contacts. In the case of San Pedro, we also have to go back to almost the second week of July. And in the case of Orange Walk, it's probably the third week of July. So people will have to have a recollection of where they were the previous 14 days.
So,
And so
so
your
for
mapping
some of
exercise,
the contacts, you're looking at almost remembering almost a month worth of interactions.
that's one, if you can recall those. And that's why I said, as we move along now, every single person in this country has to remember who you interacted with for the last 14 days. And if we did not go away with that notion that every person you meet you have to consider as a potential case, then you realize how difficult it is. I mean, if we have not started to internalize that message beyond this famous date that is latched onto people's mind, of August 15th. Yesterday I said, and I had said it before, I believe in a forum with you, that plane has landed. I don't know why we latched on to August 15th. And I think that's where we, as a broader community, may have missed completely the message.
Yeah.
Has there been any indication as to the source of these? I mean, Corozal, many people will assume, well, there's some case of maybe border jumping and Orange Walk. But the San Pedro case, has there been any indication as to where these persons may have come in contact with COVID-19?
We are, based on what information we gathered yesterday, and we have to be detectives in the work that we do. So there's a lot of detective/police work that needs to happen. The link, I think, is going to be in San Pedro to Orange Walk. So I think we are thinking that it may have been from Orange Walk going on to the island. Recall that from yesterday, we have one case in San Pedro that is linked to the case, as far as we know right now, is not linked to that case that is already in San Pedro. That's a separate situation that we had been alerted at a public gathering where somebody was visibly ill and the other people around had started with symptoms. So this person came forward and got swabbed, and that's why that sample got processed. The persons who around that specific cluster identified yesterday, those should be tested today. So you might be having two separate clusters at least in San Pedro by the end of today.
Have you gotten the results from the bank employees as yet?
From the ones that were
In
swabbed
San Pedro.
San Pedro, yeah.
No.
Okay.
Wow.
So is it your expectation, Dr. Manzanero, that we'll be seeing another bunch of positive cases today?
We can anticipate more positive cases today, yes. I believe we are starting to see now in Orange Walk, the link might be just outside of Orange Walk as well, to a couple of villages. So we should have all that data by the end of today.
We have at the start of this entire pandemic, Dr. Manza, when we started to close borders, or we actually had San Pedro quarantined off, there was a lot to take in, and a lot of people were actually afraid. So there wasn't any social gatherings, or even if you meet somebody, you didn't want to greet them the way you normally greet them. But following the not necessarily an all clear, but we were actually not without COVID-19, everything went back into place. People started to get relaxed. Would you refer to this one as a second wave? And what have we learned from the first or from the previous cases that we're trying to implement to make it even better for us now in terms of tracing, in terms of trying to get everybody on board? What have we learned from there, from the first time around?
I think this might be actually the first wave. I don't think we got necessarily all that tested the first time around. As a community, I think that there's lots of things that we did not learn. And that's the reason we are where we are, because we assumed that we were safe. We assumed that if there was no plane landing, nothing was going to happen to us. As a community, I know that one of the key items that keeps popping up is the lockdowns that happened, which were effective, but on the same token, once that happened, people started complaining at health, saying why, if there's nothing going on. Well, if that happens, I don't know how long we can expect to be locked down and what other implications that has. But in further thought processes last night, if we require lockdowns to change our behavior, then I guess that addresses part of the answers to the question you just posed, because then that means that as a society or as a community broadly, we may not have learned anything if we have to be locked down to get this process right.
But it is
From
a
the
possibility that we may enter, or there may be pockets of society that may be put into lockdown again. Is that the
yeah,
case?
I mean, that will change as we move along, and we make recommendations. I need to stress
I was
that.
going to say, you make the recommendation. In fact, you don't issue a lockdown, you give the recommendation. I think to the NOC, then it's taken up. But what
Yeah.
markers do you use to decide whether or not a community goes into lockdown?
You see, the key item here, and that's why going back to the question John just asked, is do lockdowns necessarily work? But I wouldn't want us to just hinge it around a lockdown. If we are not going to be changing our behavior, then we can anticipate that how long are we going to be locked down for? 2 years? No school, no airport, no border being open, simply because we are failing to internalize the message. We are failing to take levels of personal responsibility. So lots of flare-ups, lots of messages we get. Well, it's the government's fault that we are where we are. It is the Ministry of Health's fault that we are where we are. And we knew that this was going to happen. But that's not the way if that's the way we are going to go about then we will continue to have this situation. And I hate to say this, but it may take us filling up hospital. We complain about a weak health system. We have been trying, we know our deficiencies in the system. We have been trying to do and establish good public health measures precisely because we know what we have as a health system. So that when people are concerned about ventilators, we will want to prevent you from getting
on a ventilator. Absolutely. And I hear your plea, and I think it's echoed by many in society. For those who are following through with the prevention protocols that we're being asked to follow, I hear it. I know the public health messages have been constant and consistent, I think that when we look at what's happening in other parts of the world, people who are entering into their second waves, it seems that lockdowns are what they go back to, at least to get to a period of containment. So I go back to my question again about what markers do you use to decide to make that recommendation that a community goes into a lockdown?
Well, one is whatever we find at the end of today, because what has also happened is you learn even from a lockdown. You recall the situation in San Pedro when the lockdown was done just for that period of
yes.
Yeah, with the first case.
The measures that people took, and eventually, I mean, you had so many people leaving the island that made it, they were risking their health in some other way, shape, or form. And that necessarily didn't help with the contact tracing. So I had said yesterday, when people saying, well, people are going to start leaving the island, what's happening in San Pedro? My question is, well, where are you going to go to when you have to consider that basically you're going to find a case anywhere you go to now in the country? So I know that the link is more than likely going to be to Oranjuac and Corozal, but it that the people from Oranjuac and Corozal haven't been anywhere else in the country, or that you don't have any other cases in the country. As I said, the mapping.
But we've had a lot of people traveling to the different tourism spots. There's a promotion for local tourism. But if I could get just a bit more clarity, are you looking, like, if there is a case in, and we don't have to focus on San Pedro, it could be Corozal, if you realize that there's community spread where you can no longer make a link back to that first positive case, is that when you make a decision to issue or to recommend a lockdown of that area?
More than likely, yes. We had said once you have two unlinked clusters and active clusters in a given community, you need to lock it down. But you also need to have a plan in action, because if you start locking off zones of the country, you need to make sure that it's going to work.
Yeah.
And we don't want people just leaving en masse
Yeah.
from the areas that are potential sources to take it elsewhere. So that's the reason why you also have to be cautious about how you implement a lockdown.
Yeah.
Um, and I mean, again, lockdowns, when we had initially recommended, was to help us in the contact tracing, not because we want to keep people trapped.
Yeah.
Oh, okay.
So that they
I think,
wouldn't leave the island, that you
Yeah.
could find them and be able to do the testing. When we saw the last national lockdown, when the entire country was collectively locked down, it was when there was a detected case in Belize City.
And
Is that the same? Is that the same protocol that will be followed this time around? That if we detect positive cases in Belize City, that we will move towards a national lockdown?
remember that before the Belize City, there was actually the Cayo case.
Yeah.
And then the link came up to Belize City, and that. But again, you learn as you move along. So this is for contact tracing purposes, because people are saying, well, people are saying, lock it down, then got upset when it was locked down. But again, I think it's levels of responsibility. So
Yeah.
even if there's no lockdown, if I don't need to go anywhere, what am I doing on the street?
Yeah.
Do I
That's true.
need the government to tell me that the bar is not going to open for me to not go to the bar? So that's why it takes levels of responsibility. If the people think that a lockdown is the ultimate answer, then we have to be prepared to lock it down
Yeah.
for 2 years. And I don't know what we're going to be doing 2 years lockdown.
So
If that is
yeah, and we know the economic implications of the lockdown, so I'm sure the business community is paying keen attention. But nonetheless, one of the other issues is looking at mass gatherings. So whether it's a school meeting, whether it's some kind of social activity that involves a lot of people, currently there aren't restrictions on number of persons. Is that perhaps a first step that the Ministry of Health may entertain in being able to cut down on the groups of mass gatherings so we don't face what we're facing right now in your contact tracing?
That's one element, but also the elements of physical distancing, the elements of
Absolutely.
wearing a mask properly, which we seem to have I mean, and mind you, I'm not saying that everybody's doing that, but
Yeah.
it only one person to not do it for us to go down that road.
Yeah.
Yeah, that's one. Mass gatherings. I don't know. People are saying curfews work. I don't know. I mean, from a personal vantage point, a curfew doesn't really mean um, uh, much in terms of what we are going to be able to do as health, the work on the ground. Then
Yeah.
it may help in other elements, but I think all of those pieces of the puzzle start to be placed again.
Yeah.
You have to go back to what we did, what we learned, or what we should have learned,
Yeah.
Yeah.
and then come up with a collective decision or recommendation from our end.
What is the verification process in the contact tracing? We've seen cases just in this recent period after we had our containment where persons didn't factually disclose their interactions, and in fact you found out through other persons or found out after the fact. How do you verify with the current positive cases their actual history of interactions with persons?
It's usually close contacts, because once somebody tells you a piece of the information, we will go and try to verify it with your immediate close contacts. Or usually when somebody doesn't disclose that, we try to identify who your close contacts are, your work environment, and then that's how you try to do that
Yeah.
puzzle, build up your puzzle then.
It must be frustrating, though, that they're not honest.
Yeah, I was in the HIV, and I probably shouldn't be making that comparison, but that's the same level of contact tracing you do with sexually transmitted infections and with it to include HIV. Same thing here, because you find out lots of information. I jokingly told Commissioner of Police yesterday when we chatted briefly, that people now that they are afraid tend to confess more to health than they would to the police. And so you find out that eventually, once people getting afraid, they start to shout information, and then you start to realize how expansive your network can be. and what other elements come into play into people's private and public life. So that's why we always try to safeguard that, because people give us information in the
Yeah.
hope of trying to get it.
And
So
the
that's why we
the,
don't go on.
sorry, yeah, go ahead.
No, we don't go and disclose information unless we assume that it has public health relevance, like we have done in the past. So, depending on what is shared, is what, depending on the value or what it can gather from us from the general public, that's where we will.
But
The tip line is still open, though. People can call in and
Yes.
give information if they do know of some of the interactions, right?
Or if they have are starting to become symptomatic. We did start to get a lot of calls from yesterday. So at times the number is going to get busy, but starting to get people now again having panic attacks, levels of mental stress that we are going to have. I'm not sure it actually went down. It's probably not as
Prominent.
open at the forefront as it is starting to become now.
Definitely.
And
You know, one of the
looking-
things that Dr. Manza, we did mention that border jumping is actually a crime, which of course it is. You're you're crossing borders illegally, which is definitely a crime. And we saw some spikes, not necessarily spikes, but we saw people being infected for border jumping and contrabanding. And as a matter of fact, I think on record at this particular point, Chester Williams, who is, of course, the Commissioner of Police, have been asking for help from the standpoint of getting vehicles to try and, corral these borders and try to get things into place with these people who are actually border jumping. People are actually wondering if, especially for border jumpers who've been caught already, have they been paying the price? Is there any one of these people who have been who have tested negative or are clean of COVID and then went to jail? Do you have would you have that information?
As far as I know, everybody has gone to jail. I actually, you recall, I think the first couple that was made public was in April. The couple that had children, I think they may have their time within at Colby. The last note I knew of was 16 people had been taken because after the quarantine period. Recall border jumpers are not only Belizeans but foreigners.
Yeah.
It happens on a weekly basis. Once they are cleared, they are taken to Colby. But again, I mean, how overwhelming can it be if you suddenly realize how many people will have to be at the Colby Foundation? But beyond the prison sentence, it's the implications we have with a potential public health situation that's brewing.
Yeah. Looking at the situation with the positive cases so far, so the 3 who required hospital care, what is the current status of these regional clinics and hospitals to be able to manage cases? So you have the polyclinic in San Pedro, you have Northern Regional, and then you have the clinic in Corozal as well. Can they manage cases to the most severe, or do they manage mild to moderate? What is the capacity given the areas that have been identified with positive cases?
Well, Corozal had 8 beds that they could have used.
Okay.
Joac at last count had 6. San Narciso has a flu clinic, so they would have to be managing mild cases. So we had a clinic, flu clinics established in Independence, Punta Gorda, Tangriga, San Ignacio, Belmopan, and in Belize City. In terms of referrals and where they go, they would follow the same referral process as anybody who has a flu who becomes complicated and requires levels of intervention. So out of the patients that were ill through the weekend, I don't believe that any of the 15 cases identified yesterday are severely or ill to require hospitalization. Again, that by the end of the day. But the one that was, of the 3, the one in Corozal was the one that was more ill, that had been requiring supplementary oxygen and was having levels of physical distress whenever she was taken off the oxygen. That case is managed in Corozal.
Okay.
So when she be referred, we still have an internist that can go and do rounds in Corozal.
Yeah.
Whenever she doesn't, that hospital can manage and she moves to Orange Walk. If you require ventilation support, if you require that, then you follow on to Carlusion. That's the way you manage any flu situation. Right now, it's the same
Yeah.
referral process that will be followed for any case.
And in
If the
San
patient,
Pedro?
it's the same thing. Whatever you can manage there, you manage. You don't wait until the patient becomes too complicated for them to be brought to mainland. And also underscore the fact that if you are not severely ill, you're going to be managed at home.
Okay. Now, when you look at the landscape of what we are facing just in less than a week, the children go back to school on Monday. We are opening the airport the Saturday that follows. How do you put this current wave into context as to whether or not these reopenings will be allowed to happen?
Well, those are all in the plan. I know Ministry of Education has their plan. If you find that there's community transmission in any community or district, that district may not be able to start their activities as planned. But that doesn't become a blanket statement for the entire country. If you don't have any community transmission in Toledo district, we had said you're going to have to section it off. I know we are very interconnected, but you have to follow what's those guidelines, what is established, and what mechanisms when you actually lock down. The airport situation, as we said at the press conference, it seems that most people wanting to come back. Planes, the first flights are supposed to be full flights, are actually Belizeans more than tourists. So how do you factor them coming actually home? It's not people wanting to come as tourists, but factoring the fact that people want to come home. We had said also from the beginning, and again, that message has been minimized, that the concern is going to be Belizeans returning home because they are going to their families and to their communities, versus the tourists that are coming to specified areas, specified locations with specified interactions that are supposed to happen. That's where you balance that. The school situation is very fluid. It depends on what you find, and you make recommendations based on geographic findings.
Okay. And just one final question for me, at least, is just when you look at the conversations we've had previously, you'd always warned of a second wave, but we were talking about October, November, when we know there's a very active flu season. And so when you see this particular wave starting at this point, how concerned are you if this extends into the actual flu season?
Well, I still think there's a level of containment that can be done if we start to take the necessary precautions as a community. I think, again, what we want as a health system is to make sure it's not overwhelmed. Right? You always have to be looking out for the symptomatics and find out how ill they are. I believe 2 persons from the 15 yesterday are older than 70, so those are populations that will bear more of a concern, immediate concern, that is. So I think this can still be contained. I don't know how many more times will come around because I don't know that the border jumping is ever really going to stop. That's we are geographically. But I hope that we are able to take and internalize the message now. I don't think we need to start seeing people lining up to get into a hospital, people dying, or seeing what happened in Mexico where people were lining up to buy beer and 2 weeks later they were lining up to rent an oxygen tank. I hope to go down that road. I hope that this is a rude awakening with the raw data, and not to be concerned about when the airport opens. If I said this plane has landed, I mean, it's here. Still anticipate that the wave can get much bigger in October, November, December. Yes, because you're going to be having 2 issues to deal with: the flu situation, and if you have community transmission, you're not going to be able to make the differentiation because once you have established community transmission, it doesn't mean you're going to go and test everybody in the community. We have said that has not changed. So how are you going to make that differentiation? So that's where we need to be able to balance it. I think we have the opportunity. I hope people are able to wake up today and realize that it is here, that it's not going to go away, and it shouldn't be. Our concern cannot be just around school opening on Monday or on August 15th, but the concern should have been there from January, and that stays with us because COVID-19 is not going anywhere.
And just last advice to people, I think right now, when we look at the current context of the situation, we think, oh, well, if I'm not in Corozal, Orange Walk, or San Pedro, I'm safe. But I've heard you say, and I am aware, that there are there are contacts who've moved all over the country. So it's about a collective wariness that we do have to have and proper practice of prevention. What do you say to the public right now who, I mean, whether you agree or not, are very concerned waking up this morning with the latest news?
You have to assume that you are, that everybody you meet is COVID-19. Or maybe the message is going to be, you have to assume that we are all COVID-19 infected. I mean, I know that I started getting that message when I was HIV. Yeah. So if you have been in contact with anybody, maybe if we start to think of it like that, then that I am a potential case, taking it home or wherever I'm going, that's perhaps where we need to start to internalize the message. So take the necessary precautions. Those should have never stopped. And that is the message. Everybody you meet on the street is a COVID-19 case. That's the way you need to say it.
Dr. Manza, I know you're a very busy man today, and we do appreciate you following up with us this morning, at least to get some clarity as to what the current situation is. Thank you very much. Best of luck and stay safe.
Thank you. See you.
All right.
All right, we're about to take that break, but when we come back, we'll be having representatives of the Ministry of Health in to talk to us about Breastfeeding Week 2020. So stay with us. We'll be right back.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.